Hi, I'm Megan Barrio. I'm one of the CANS certified aesthetic nurse injectors here at Cynthia Gregg, MD, face and body specialist.
Hi, and I'm Nina Clark Christoph. I'm also one of the CAN certified nurses and a great colleague with Megan here. Today, our presentation talks about optimizing results and patient safety. And at the end of the program, if you have any questions, please send us an email at injectablequestions@cynthiagregmd.com. And so we're going to talk about one of my favorite topics, safety.
And Nina has been our safety officer for quite some time and has now passed the torch over to me, and I'm the safety officer for the office. And we periodically go over our procedures and make sure that we're doing the best practices to keep you safe.
So we'll talk a little bit about some of the things that we do. One of them is with any of the injectables like Botox, the neuromodulators that we inject. There's a reason behind when we tell you that we don't want you to leave our office and go get a massage and put your face down, go to yoga class. We want your head upright for 4 hours after because we don't want that to move and go to a place that we didn't inject you. And with fillers, we have even more rules. You want to talk about that, Megan?
Yep, absolutely. So, one of the things we want patients to, or two of the big things, is no dental work 2 weeks prior to your treatment, as well as no vaccines 2 weeks prior to your treatment. And that actually also goes for after your treatment, 2 weeks after, no vaccines, and 2 weeks after, no dental work. And that includes a cleaning. The bacteria in our mouths can get into our bloodstream, which can then travel to where we inject. And so we want to make sure that we are as safe as possible and we avoid that basically have a 4 week time frame where we're not worrying about vaccines or any dental work.
Right. And the reason for the vaccines, and we learned this with the COVID vaccine, is that there were nodules. They all resolved spontaneously, no action needed to be taken. It happened to me after my first COVID vaccine. My chin looked kind of like Jay Leno, it was pretty big. It went away. But we don't want you to be worried for 2 weeks. We don't want to worry about you. So it's just a good rule of thumb. And it's not just the COVID vaccine, it's really any vaccine, shingles, pneumovax, flu vaccine, RSV. So 2 week window either side helps to prevent that.
Mhm.
Fever blisters, you want to talk about that with
Yep.
insular injections?
So we also can call in a prescription if you have the virus and you get cold sores. We can call in that prescription for you to take the day. We have them take the day before, and then also 4 days after, just to make sure again that we don't have any active infections.
And then the scariest thing that we're always on high alert for is, for heaven forbid, that we inject a filler into your bloodstream. It's called a vascular occlusion. We're always prepared for that here. We only inject, the nurses do, when Dr. Gregg or Dr. Wu, at least one of them, is physically present in the clinic. We're not a medi spa where there's no physician available. We have a kit prepared. We know how to handle things, so you can feel sure that safety is of our highest priority for that.
Mm, absolutely. I was going to say we have all of that on hand. That's what we keep track of here in the office, and having the doctors here, I think, is wonderful both for the injectors and for the patients.
Right. And the other accreditation we have is LAC.
Yep, we have the AAA HC accreditation for our surgical suite, which is the highest accreditation you can get, which we keep updated every 2 years. And That's just wonderful to have on our record as well, assuring for the patient.
And then one of the things I wanted to speak about was a year ago, there were issues with counterfeit Botox. You can feel sure that when you come to our practice, we only get that from our vendors. There were people that had problems, were hospitalized with symptoms of botulism. And so I can't imagine that you would ever want to go and risk that and go to a Botox party. None of those type activities are condoned by any of the academies that Dr. Gregg and Dr. Wu participate in. And it was just this July that there was actually a person in Florida who was not a medical provider, not a nurse, a physician, a PA, or nurse practitioner, who actually had a shed and was in her backyard injecting. A patient had facial paralysis, and, again, not necessary. Typically, people do those things because it's a lesser cost. Um, we give you a great service for the cost that we provide.
Yes, absolutely. There's so many of those stories, which again is why we put safety as our top priority in this office. Thank you so much for today. Thank you for watching our video. We have automatically entered you in to win any of our drawings and prizes.
Thank you.
Thanks. Bye.